What's up, tribe? Nick here from Ottawa, and in today's tools video we're going to cover knee to wall. So knee to wall is a really powerful tool to be able to understand and be able to master, because it gives you something that lets you reliably measure your ankle mobility. Okay, so if you have tight ankles, or you think that your inability to squat, for example, is coming from ankle tension, then it's really important to be able to measure your ankle mobility, both to compare left and right sides, but more importantly to compare before and after you do some sort of intervention. Right? So if you can't have some reliable way to measure your ankle mobility, then there's really no way of knowing whether or not you're improving. Right? If you can't assess, then you have to guess, and we don't want to guess. We want to take a systematic approach to tackling ankle mobility problems and being able to confirm that what we're actually working on, the strategy that we're taking, is actually succeeding in allowing us to improve our ankle mobility. Okay? So in this video, I'm going to demo using a beam, but I would recommend using a wall at home. That's why this test is called knee to wall. And basically, in a nutshell, what we're doing is measuring the distance between our toes and the wall at whatever distance we're able to essentially get our knee going over our third toe to be able to just touch the wall without the heel lifting up. Now, a few important things I want to say here. Number one, the point at which you stop pushing forward is very important. Right? You're not trying to go to the point where you get excruciating pain and you feel like your ankle's about to explode. You stop at the point of first resistance. So as soon as you feel that something is stopping your ankle, stopping your knee rather, from going further over your foot, you stop. It's always nice to take a note of where that point is. For example, if I go here and I feel like my calf, if I feel a bunch of tension back here, that's the first point of resistance, then it might give me a hint that maybe my calf tension, the tightness in my calf muscle, is stopping me from moving my ankle further into dorsiflexion. Okay, and how that would play out is, okay, well maybe I'll loosen up and reset my calf and see if that makes a difference in my ankle mobility. Okay? If you get a pinch in the front of your ankle, that tells you it's more of a joint issue instead of a soft tissue issue. And it tells you that the joint essentially isn't allowed to glide like it's supposed to, which can be a factor of a tight capsule. It can be a factor of also a tight calf. So we're not going to cover exactly what to do if you get either of those two scenarios in this video. We'll talk about that in another video, but just note where that point is and know that you're not trying to push through pain. You have to be consistent in how you acknowledge that point of first resistance. So no pain, just when you feel some sort of resistance stopping you from going further, that's where you stop. Now, really important with this is that your knee always stays over your third toe. Okay, so if I go to here and my knee's over my third toe and I can get there and that's as far as I can go, well, if I let my knee cave in and my arch of my foot collapse, I'm going to be able to get a bit further. But essentially I'm cheating there. I've gone past the point of my ankle range of motion, and now I'm cheating by collapsing through my foot, which you don't want. So knee over third toe, heel doesn't come off the ground. Okay, so make sure, sometimes I'll do this with a partner and I'll get the partner to put a piece of paper under the heel and put some tension on it, because some people don't actually know when their heel is lifting up. So you have to make sure the heel stays on the floor, the knee goes over the third toe, and the point of first resistance is where you stop. Okay, so you start fairly close to the wall. I also like to make sure the wall that you're using doesn't have a baseboard, okay, because that can throw off the measurement a little bit. And basically what you're doing is you're starting pretty close. I can touch with my knee over third toe, I can touch there. So I'll go a little bit further, I can touch there. And you essentially keep going until the point where you can just touch. This isn't a balance exercise, so hold on to something or someone. I've got the beam, so it's keeping me balanced. So right about there is that's my limit. So I can just touch with my knee going over my third toe. I'm not getting any pain, my heel's not lifting off. And then what I would effectively do is measure the distance between my toe and the wall. And that is your knee to wall distance. So you do it on your left, you do it on your right, you can compare both sides. I like to mention that a good goal is to get within 1 centimeter of either side. Right? So if there's a big asymmetry, it tells you something. Sometimes it tells you something about how the hip works upstream, because the ankle and the hip are like this. If one is doing funny stuff, the other one's probably going to be doing funny stuff as well. Okay? So we'll talk about what to do to improve ankle mobility in a couple other videos. But for now, it's just getting a measurement, getting the amount of either inches or centimeters on your left and your right as a baseline measurement, so that you can track your improvement moving forward. Okay, so do this with a friend, do it on yourself. The more frequently you can do it, the better. This gives you a powerful tool to be able to measure week over week, month over month, but also even just Measure before, do an intervention, measure after. Did it change? And that can tell you whether or not what you just worked on was the right thing to work on, because there can be a lot of different reasons why your ankles get tight. We'll talk about those in other videos, but for now it's just be able to reliably measure your ankle mobility on your left and your right, so you can compare both sides, and so you can compare to see how you're making progress over time. Okay, hopefully that helps you out. That's knee to wall measurement. Try it out, let us know if you have any questions, and if we need to film another video to better explain it, we will. Thanks for listening.